Windi is actually a PhD turned entrepreneur.
Yes.
So excited to have Windi on. She's the co-founder and CEO of Resistomap. And Windi, if you want to fire up your presentation, we can get started. All right, I'm going to hide my face and we can get started.
Resistomap. We fight with the superbug, bacteria that cannot be killed by antibiotics. Antibiotic resistance in hospital is a real problem, and it is happening globally. Especially now during the COVID-19 outbreak, the use of antibiotics is significantly increasing to treat the secondary bacterial infections in the patients. High use of antibiotics can increase the level of resistance in bacteria. Can you imagine if all antibiotics in hospital are not working anymore? Are we ready for the next outbreak? What can be done to prevent the outbreak of antibiotic-resistant bacteria? Together with the Infectious Disease Control Unit at Helsinki Hospital, we monitor the level of resistance in hospital wastewater. We monitor the resistance levels to all antibiotics that are used in hospital. So we receive the wastewater samples, we analyze the samples, and we deliver the result within 7 business days. This is an example of study case in Helsinki. We compare a level of resistance in 2 different hospitals. B is a big one, X is a small one. Big hospital doesn't necessarily have higher level of resistance. So the level of resistance is more likely to be associated with the number of bacterial infection cases. If we monitor the level of resistance over the time, this information can provide an early warning system before any potential of antibiotic-resistant outbreak is happening in the hospital. That's what we hope. And why use our service? Resistomap offers an easy access to state-of-the-art technology, no upfront investment, no expertise required, quick turnaround time with comprehensive result. Resistomap business idea started in 2017 and a year later is incorporated. I graduated from Founder Institute Finland last spring, and since then we have served 19 customers from 13 different countries, mostly in Europe, and we target 250,000 euro revenue by the end of the year. In average, we acquire 4 new customers quarterly. More than half of the customers in 2019 are using our service again. And each customer spend usually between 2,000 to 25,000 euro, depends on the project. We target to enter Asia market next year in by opening a new lab in Singapore, and we hope to go global by 2020. In Europe, public investment on antibiotic-resistant research is increasing 55% yearly. Resistomap is opening a new market. So to our knowledge, we are still the first and the only company that offers a commercial service to monitor antibiotic resistance directly from environmental samples. William and I are the founder of Resistomap. I did my PhD and postdoc research at the Department of Microbiology in University of Helsinki. And so I spent more than 10 years working on antibiotic resistance in the environment. I have the know-how knowledge for antibiotic resistant monitoring, and I want to bring this technology that available in research to be available, accessible for everyone. William works on automation of the analysis so we can deliver fast results. Currently, we have 9 members, including 2 in the production team, 2 project managers, branding, and 2 interns. We have advisory board in business, science, and hospital. The technology that we are using now actually first developed it at Professor Chiche's lab at Michigan State University, so it is nice to have him on board. Our project is not only monitoring antibiotic resistance in the hospital, but also other hotspots such as animal farms. More than 60% of antibiotic produced are actually used for animals. So the first step to preventing the spread of antibiotic resistance is to identify, characterize, and monitoring the hotspot. Prevention is better than cure. Thank you.
All right, that was great. As I said before, anybody who has questions in the chat, I obviously have some questions for Windi, but really we want to get questions from you in the chat. I see Neil just put in a question. Thank you, Neil. Everyone else, be like Neil. Throw your questions into the chat, and we will get them up for Windi. But I guess, Windi, my first question for you, and this may be a stupid question to be honest, just because you're a PhD and you've been researching this stuff for many, many years before deciding to build the business. But, you know, why are you the right person to build the startup? And who are some of the other people that you've brought onto the team to maybe fill in some of the expertise or skills that maybe you don't have, to build it out?
Yes, I think maybe the first, because I have the big passions to solve this problem. Mm-hmm. So, and it's important to have this passion to solve the antibiotic resistance, because I spent for 10 years, so I know the problem is quite big, and I really want to do something to solve this problem. And I realized that by bringing research, like in research, there are already kind of some solution, but usually not in the practical, in the real life. So right. That's why I think why I'm the right person, because I'm willing to move this academia to the entrepreneur's life. I don't know how is it for the others, but it's not easy change the work life from academia to entrepreneurs, but it is very important, and that's why I think what we are doing now is, I hope that can bring the research solution in the practice faster.
Yeah,
and
that makes sense.
Yeah, and about the expertise, maybe because in the marketing and business, as you know, I'm very person working in the lab.
Yeah.
So the need is in the business side to make sure that what we have can be deliverable.
Okay, interesting. All right, so back to Neil, and people are asking questions in the chat, so please, thank you. Just want to keep encouraging that. But Neil's first question was, just wondering who actually conducts the test. Does it require a lab partnership or custom equipment?
So the technology is available. It's using the SmartChip SmartChip qPCR. If you're familiar, so it's like just to detect and quantify the genes of the bacteria. And this is already in research since 2014. So if you search in the publication, there are many research using this technology. So what I do is like only make this technology available for everyone, or accessible in this case.
Great. And is there a hard cost? This was just the second part of Neil's question. Is there a hard cost to each test?
Yes, there is of course, the cost. Like, you mean like the production cost?
Just the cost for each test to conduct was what he was asking.
How much?
Yeah.
It depends on the assay you want to monitor. So if you monitor many genes that I show in the example, so you can like pre-screening quite a wide range of different antibiotic resistance. It costs around 500 euro per samples. And then if you later on only choose a few genes or like few bacteria that you are interested, and it can reduce to the price of the sample up to only 35 euro per samples. So this is why this technology is quite flexible, and it can fit to your research need.
Cool. So Reed asked, can you explain in greater depth what the hospital actually does with the information that you're providing them?
Mm-hmm. So we are working now with the infectious disease control unit. So this is not the hospital, the doctors who are using this information, but more in the management level. Especially this information can be used to make the policy on how to use the antibiotics in the hospital. Because the idea, of course, we want to prevent the potential outbreak of resistant bacteria to certain antibiotics. That's very important.
Mm-hmm. Mm-hmm. Okay. Davey asks, now I know you mentioned, that as far as you know, there aren't really any direct competitors of people who are doing this in the environmental realm. Are there other indirect competitor substitutes or something like that, kind of in the field that are doing similar stuff in antibiotic resistance?
Yes, of course. Like it's mostly like then the researcher itself who are doing this research. So they usually can use metagenomics methodology or sequencing or by cultivation. So of course they are like, in this case, like people who are working in universities or in the research institute, they can use method whatever they want. In this case, it's indirect competitor. But then when I introduce the solution that I have or the service that Resistomap have, most of the people or most of those researchers are tuned to become our customers. Because we can deliver fast result. I think that's the make they choose us in this case.
Right. Yeah, and that should help. And that sort of can lead into Frank's question on the sales cycle, right? So if you're already having some of these researchers using your tools just to so that they can make progress on their research faster, that should help you on the sales cycle front. But you know, just in general right now, do you guys have an idea of what that sales cycle looks like?
Yeah, because it's a new market, so most of people actually not aware that this needs to be done. So the sales, it depends also of how we try to first educate the customers that how important it is, and then after that actually quite pretty quick in the sales, because every time I meet the potential customer and explain the situation and how we provide the service, it's very easy to turn into customer. So the sales wise is supposed to be is getting bigger or increasing, because the situation of antibiotic resistance unfortunately is not slowing down. It is increases, especially as I mentioned, because of this COVID-19 outbreak. The use of antibiotics is even like higher. So I'm a bit worried actually after this COVID outbreak, what is the level of resistance? And that's why
in terms of higher use leading to more adaptability for the pathogens. Yeah. So Gerald asked a question here, and there's a lot of like very technical questions in here, Windi. So what I would recommend is I'm going to try to not get into the most technical questions. But the ones I would definitely recommend you, when we're done with the on-air questions, you go into the chat and get into some of these technical I mean, there's words I've never even heard of in here. So I'm going to try to keep it to some of the more high-level ones. But to everybody in the chat, keep them coming. Windi will come in there and answer some of the more technical questions afterwards. But Gerald asked, how does, you know, and I guess this is just kind of the basic science behind it, but how does measuring antibiotic drug concentration in sewage, how does that tell you about the antibiotic resistance of bacteria exactly?
Okay, so what exactly we do is we collect the genetic material in the wastewater. So I mean every genetic material, including the bacteria and the virus, in of course in our cells also, but all this genetic material is the DNA. And then in our technology, we have this called a primer set. So it's mean that kind of a hook, you know, if you go fishing, if you have this hook, that specific hook to catch the fish. So it's the same. These primers is the same like hook to catch the certain resistant genes that carry by bacteria. So that's, in this case, we quantify the number of the genes in that samples. And that's why we can have the result that what type of the resistant bacteria there, and how many like the quantity of the bacteria there. But in this case, so it means that we are using the genetic materials.
Got it. And then the next steps, Angelica was asking, once you see that there is that resistance, then what are the next steps that are able to be taken quickly?
Yes. What we do now at the moment is a pre-screening in different kind of hotspot. So one case, that example, like in Sweden, so they monitor the different source of river into reservoir for drinking water. So there are like 6 different rivers enter this reservoir. And then when we monitor the 6 river, there's one river actually quite high level of resistance. And we were like, of course, wondering what happened. And this water management tried to check in the upstream of the river. It turns there is an animal farm there, like small animal farm owned by a family. Then we realized, okay, so then they need to inform that the waste shouldn't throw directly to the river. So this is like one of example case that this data can be used.
Right. Okay. So yeah, there's a ton of questions in here, Windi. So I would definitely go into the chat, but I'm going to finish with two quick questions here. So the first one, and obviously this is going to come up because we are all suffering in one way or another from this global pandemic. You know, are there now? You had mentioned as a result of COVID-19, you think that our tracking of the resistance of bacteria that's just gonna become much more important just because of now, are there other applications related, you know, or impacts of COVID-19 where you think your business can and your research can play a really active role?
Yes, actually, we try our best now to improve our laboratory for infectious samples.
Mm-hmm.
So we also can add the service to monitor these SARS-CoV-19 genes, because it's important. Like, okay, we pass this outbreak, and then, but how about if these viruses end up in the environment and still lingering there? So there is the potential we need to also monitor routinely. So then, if there is some potential this infectious, and I mean not only this virus but any infectious in our environment, that we can pinpoint, or like kind of an early warning,
Yeah,
that there's maybe potential outbreak occurring. So that's we tried, but let's see. But this is now, it's kind of very important for us now to do preparation or like prevention,
of course,
before it's too late.
Unfortunately, this is not going to be the last pandemic.
Yeah.
So, and then the last question here is from Federico, and a very apt question, Federico. It's, how can we help you, right? How can the audience help you? Are you looking for are you looking for funding? Are you looking for partners? Are you looking for new clients? What is sort of your ask here?
I would love to have a network to get more clients and customers around the globe, because our vision is to map antibiotic resistance across the globe. So it's nice to have this Founder Institute network around the world, like 80 countries. So please spread the words. I mean, we should do this together, because I cannot do, of course, by myself, like alone or not alone, with my small team in Finland. Mm-hmm. This needs to be done together around the globe. And then if you have laboratory in your country that have at least to do the molecular genetics, ring me the bell, and we can collaborate together to provide this Resistomap service also in your country. So I already done now in Singapore. And then, I hope to get more access to other people in other countries, and so that we can, do this together.
Awesome. All right. Well, thank you, Windi. Anyone who wants to contact Windi, her information's here, and anybody else who's watching, you'll also receive the information and the video of all the pitches via email. So thanks, Windi.